How low are we going? We are going low. My name is Tamara Green, and I am a pelvic physical therapist, and I help women overcome that uncontrolled bladder, return to that pleasurable sex, and manage those pregnancy symptoms so you can become a postpartum champion. So, me and my girl Virginia, as we are always here, we're going to be discussing today, are you engaging your core, or are you actually just sucking in your stomach? Now, when we are trying to get that right picture, we're going to have to get the right spot, the right angle. What do? We try to pull in our stomach, right? Well, yeah, pulling your stomach, you may be thinking you're tightening your core or engaging your core, but you may just really pulling in that belly to get that right shot, right? So, what I want you to understand in the importance of, are you engaging your core versus if you're not engaging your core, here are some things that you can notice if you're doing it right. Now, if you're engaging your core when you're walking, doing different tasks, when you're picking things up, you'll feel like you're bracing, like you have that support. It's almost like you have like a band or something that's wrapped around that you're as strong as you can be, and you're embracing that core. If you're embracing that core, you will have the decreased pain when you're walking. You'll have the decreased pain when you're in the kitchen cooking or cleaning or doing any of those tasks. You will have that. So then you may say, well, how do I know if I'm having an issue? Well, if you're having an issue, you may say, I can be walking or I can be doing things, and after a time my back just starts hurting. I can't stand that long because my back is hurting. And I promise you, every single woman that came in my office today, when it came to pelvic rehab, each and every one of them had a story. And each of you have a story. I have a story. But they all had a story. I had one client, she came in, or a patient, she came in, she had previously 2 back surgeries. She had 2 back surgeries, but she still had core weakness. She said, I can't get up off of the floor. Or I went into a store one day, I kneeled down. When I knelt down, what happened? I was embarrassed. I couldn't get up off the floor because I didn't have the midsection strength to get up off of the floor. She also said when she went to church, she can't get down at the altar to pray because she doesn't have the core strength to get up. And it shows you the domino effect. If that core is weak, what happens? It puts a strain on your back. Putting the strain on your back can cause what we think is hip pain, and it really is the sciatica. It's a domino effect. I'll give you another example. I had a client that come into the office today, or patient, she came in today, and she just has weakness. She just has back pain, didn't know when or where it came. She did notice it happened more or less after she had a baby. She's a runner. And there's a lot of stress on the body that goes on when you exercise. And what happens? That strain of not having that midsection support it takes more work. So you may feel like you have to wear a girdle or a binder or some type of support to give you that support that you're needing, and it also helps you with your back pain. That's a sign that you have a weak core. Another client came in. She was talking about, she had issues with incontinence. Weak core, I noticed, and I can't diagnose a hernia. She had a hernia. You notice that enlargement, like if you sit up, you notice like a bulge or a ball in your mid-stomach abdominal region. She's noticed ever since that component of time, she's had issues with incontinence, leakage when you laugh, cough, or sneeze, or that sense of you gotta go, that urgency can come. So I'm giving you 3 different examples. There was more people that came in, but just giving you 3 examples of 3 different scenarios where each and every one of those women had an issue when it comes to the core. And I can shout it out from the rooftops about how important your core is. When I say it is important, it is important. Again, we miss a lot of that when it comes to your core. We think, oh, it's your back, oh, it's your pelvic floor muscles, or it's your hip, but a lot of times if that core is weak, it can make a domino effect of each and every one of those systems or those components of your body that makes you feel like you have an ailment, you have an issue, but that issue is still coming from the root of the problem, which is your core. So a lot of times, in every single woman, not every single woman, but Most women come in and I say, hey, I need you to show me the best of your ability. Can you show me how you can engage your core? 9 times out of 10, I give them an A for effort all the time. But 9 times out of 10, they are not engaging their core. You're either holding your breath in. You should be able to stabilize your core, maintain that stability for support, and breathe at the same time. Or you're lying down, you're trying to tighten your core, you can't quite do it. So I need you to understand, if you can't engage your core properly in a lying down position, more than likely it's going to be harder to do it standing up against gravity. So what does that mean from a functional standpoint to you? That means if you're picking up heavy groceries, if you're picking up a laundry basket, if you're lifting your child, if you're picking up something out of the car, if you're putting something over your head, if you're not able to stabilize your core and you're lying down in a rested position, you're going to have more difficulty doing it in a standing position, which means you're putting a lot of strain on your back. That means you're probably doing things and holding your breath. Breathing goes along with core stabilization. Let me say that one more time. Breathing goes along with core stabilization. It goes hand in hand. If you think you're engaging your core and you're holding your breath, you may be just increasing that abdominal pressure in your abdominal region, which could increase your likelihood of having a prolapse because of the abdominal pressure. So again, strengthening your core is important, but a lot of the times we miss that component when we're having some type of strengthening program, some type of resistant program. We are not engaging your core. You can lift your leg, you can be on some type of exercise machine, giving yourself the resistance to strengthen yourself on whatever you're doing, but you may not be engaging your core. But I dare you, if you engage your core properly, you will realize how much harder it is to maintain a good core midsection stabilization and do the exercise, the resistance you're talking about. Now, you may say, hey, I've had a personal trainer. We've worked on core. And I had another client. She came in. She was working with a personal trainer. Yes, she told her, hey, pull in your belly. Just tighten your core. It is so much harder than that. If you've had multiple children, if you've had an abdominal surgery, that muscle integrity has been changed and you have to re-educate it how to do it. And you may say, well, I've never known how to engage my core. Well, if you didn't know how to do it before that, then after you've had these different changes or stages of life, having children, having some type of form of abdominal surgery, then guess what? It is going to be hard recruiting those muscles. Can it be done? But yes, it can be done. So be very careful. If you're working with a personal trainer, it is important. It is important to work on stabilization first. Once you know how to stabilize yourself, it will decrease your likelihood of having an injury if you're doing weighted body activities, if you're doing some type of resistance training. So if you're working with a trainer, ask them, how do I engage my core? And if you cannot engage your core and breathe properly, you need to relook at your task of what you're doing, because you could also be causing or setting yourself up for an injury. And there's many videos that I have done speaking of core stabilization on how to properly do it. So make sure you go back into core stabilization exercises. But I want you to know, if you're having issues when you're doing something and you're lifting, moving, doing something, you notice that your back is uncomfortable, if you engage your core, you will notice it should, majority of the time, take the strain off your back and allow you to have the stability you need to do the task that you so desire. So if you're having back issues, if you're having difficulty getting on and off the floor, getting out of the bed, doing any type of movement pattern, if you're having back or discomfort when you're exercising and doing strenuous tasks like some form of resistance training, or if you're trying to do a sit-up or something like that and you're having some discomfort, you should have a challenge, but it should not be painful. If it is painful, I need you to first relook at your core. Once you get the foundation of engaging your core, a lot of those issues will probably subside. And if you want more information, you can definitely reach out to me. I would love to be able to guide you, assist you, or work with you, however that would work for you, so you can be able to maintain good stabilization of your core. So the question is, are you engaging your core, or are you just sucking it in? So with that information and those tips that were dropped in, reassess. And if you feel like, you know what, I'm not actually engaging my core, hey, you can do something about it. If you say, hey, I am engaging my core, well, there you go. Keep doing what you're doing. So I look forward to seeing you again next with Below the Skirt with Tamara.